Have you ever wondered why doctors insist on blood tests or blood pressure checks every time you visit? Well, these are not just routine procedures or a way to fill up your medical file, they are much more than that. Blood tests and blood pressure determinations are like the opening chapters of your body's story. They offer a glimpse into the internal workings of your body, shedding light on the health of your organs, the presence of any diseases or infections, and how your body reacts to certain medications. Imagine your body as a complex machine. Now, every machine requires regular checks and maintenance to ensure smooth functioning, right? Similarly, these tests help in maintaining your body's health by detecting any abnormalities or changes in your body's system. Let's take the example of a blood test. A simple prick of a needle can reveal vital information about your red blood cells, white blood cells, platelets, and hemoglobin levels. These components play a critical role in your body. For instance, red blood cells carry oxygen to different parts of your body, while white blood cells fight off infections. So a dip or rise in their numbers could indicate a health problem. Similarly, testing for clotting time helps in assessing the body's ability to stop bleeding, which is crucial in preventing excessive blood loss during injuries. Now let's shift our focus to blood pressure determination. Ever wondered why that inflatable cuff is wrapped around your arm during a doctor's appointment? That's done to measure your blood pressure. Consistently high or low readings could hint at conditions such as hypertension or hypotension, which, if left unattended, could lead to serious health complications. In essence, these tests are your health's report card, providing a comprehensive view of your current health status. So the next time you're asked for a blood test or a blood pressure check, remember it's all for a good cause, your health. Let's delve into the first set of tests, bleeding and clotting time. Bleeding time refers to the duration it takes for a small puncture wound to stop bleeding. It's a simple yet revealing test that primarily measures the efficiency of platelet function, the tiny blood cells that form the first line of defense against bleeding. Platelets rush to the site of an injury and form a plug to stop the blood flow. It's like a rapid response team that rushes to a breach in the body's defenses. The test helps in diagnosing conditions that impair platelet function, like von Willebrand disease or thrombocytopenia. The procedure involved is straightforward. A small, standardized cut is made on the forearm, and the time taken for the bleeding to stop is noted. It's not as scary as it sounds, I promise. Next up is clotting time. While bleeding time focuses on platelets, clotting time is the star of the show for the body's clotting factors, proteins in the blood that work together in a complex sequence known as the clotting cascade. This test measures the time taken for blood to clot in a test tube, and it's crucial in assessing the integrity of this cascade. If the clotting time is prolonged, it could indicate a deficiency or dysfunction in one or more clotting factors. It's like a detective finding missing pieces in a puzzle, helping identify conditions like hemophilia or liver disease. The test is conducted by drawing a small amount of blood and observing the time it takes for a clot to form under specific conditions. So you see, these two tests, bleeding and clotting time, are like two sides of the same coin. They work together to provide a comprehensive picture of the body's ability to prevent and control bleeding. It's a delicate balance, a fine dance between bleeding and clotting, that keeps us alive and well. So these tests are crucial in identifying bleeding disorders and guiding appropriate treatment. Now let's unpack the mystery of blood groups and hemoglobin levels. Blood groups, simply put, are a classification of blood based on the presence or absence of inherited antigenic substances on the surface of red blood cells. There are 4 primary blood groups: AB, AB, and O. Each of these groups can either be Rh positive or Rh negative, making a total of 8 common blood types. Knowing your blood group is crucial, especially in situations that require blood transfusion. Providing the wrong blood type can cause a severe, even fatal reaction as the body's immune system attacks the foreign cells. Now let's pivot to hemoglobin. Hemoglobin is a protein in your red blood cells that carries oxygen from your lungs to all parts of your body. It's what gives your blood its red color. When we talk about measuring hemoglobin levels, we're essentially gauging the amount of this oxygen-carrying protein in your blood. This is typically done through a complete blood count test. Normal hemoglobin levels generally range from 13.5 to 17.5 grams per deciliter for men, and 12.0 to 15.5 grams per deciliter for women. Why is it important to keep your hemoglobin within a healthy range, you might ask? Well, low hemoglobin levels often indicate conditions such as iron deficiency, anemia, chronic disease, or even kidney failure. On the other hand, high hemoglobin levels could be a sign of lung disease or other medical conditions. So, understanding your blood group can save your life in a medical emergency, and tracking your hemoglobin levels can help you catch health issues before they become severe. Indeed, these two aspects of your blood hold significant information about your health. Knowing your blood group and maintaining optimal hemoglobin levels are key to ensuring your overall well-being. Scene script. Next, let's explore the world of white and red blood cells. Diving straight in, white blood cells, or W.B.Cs, are the body's very own defense force. They're like microscopic soldiers steadfastly guarding our body against infections. Now imagine these cells are like the population of a city. The W.B.C count, then, is the census of this city, helping us understand the strength of this defense force. A higher count can signal an ongoing battle against infection or disease, while a lower count could indicate a compromised immune system. Swinging the spotlight to red blood cells, or R.B.Cs, these are the body's delivery service. They carry oxygen from the lungs to all the cells in the body and then bring back carbon dioxide, a waste product, to be exhaled. The R.B.C count is like a check on this delivery system. A higher count can mean more oxygen delivery, but it can also thicken the blood, potentially leading to clots. A lower count could indicate anemia, potentially leaving the body's cells starving for oxygen. Now you might wonder how we measure these counts. Well, it's simpler than you think. A complete blood count, or CBC, is a common blood test that counts these cells. It takes a small sample of your blood and runs it through a machine that can count the cells and even sort them by type. It's a quick and easy way to keep tabs on your health. But why is it so important to keep track of these counts? You see, these counts are like reading tea leaves. They can give us clues to what's happening deep within your body. They can help diagnose conditions like anemia, infections, inflammations, and even certain types of cancer. They can also monitor the effectiveness of treatments for these conditions. These counts not only reflect your body's immunity and oxygen-carrying capacity, but also provide clues to underlying health conditions. So the next time you get a blood test done, you'll know what those W.B.C and R.B.C counts are telling you. Finally, we come to blood pressure determination. Blood pressure is essentially the force exerted by your blood against the walls of your blood vessels. It's like the gauge of your body's hydraulic system, giving us vital information about how hard your heart is working. Now, why is it crucial to keep blood pressure within a healthy range? Well, if your blood pressure is too high, it means your heart is working overtime, potentially leading to conditions such as heart disease or stroke. On the other hand, if your blood pressure is too low, it might mean that your body isn't getting the oxygen and nutrients it needs to function properly. So, how do we measure blood pressure? It's actually a simple procedure using a device called a sphygmomanometer. This device measures two types of pressure: systolic, which is the pressure when your heart beats, and diastolic, the pressure when your heart is at rest. High blood pressure or hypertension can quietly damage your body before symptoms even develop. Left uncontrolled, you might wind up with a disability, poor quality of life, or even a fatal heart attack. Low blood pressure or hypotension can cause dizziness and fainting or indicate serious heart, endocrine, or neurological disorders. Remember, managing your blood pressure is a critical step towards heart health. Let's quickly recap what we've learned today. We've delved into the importance of blood tests and blood pressure determination, revealing how each can provide crucial insights into our health. We've explored bleeding and clotting time, blood groups, hemoglobin levels, W.B.C and R.B.C counts, all valuable indicators of our well-being. And we've underscored the significance of blood pressure determination, a vital tool in monitoring cardiovascular health. And that's a wrap. Remember, these tests are your health's best friends. Subscribe for more enlightening videos.